and I'm able to see your presentation. I hope our participants are also able to see this presentation and also to hear you. But I'll be checking from the chat section to see any concerns that have been raised, and then I'll be able to share with you. Meanwhile, if you are in a position to talk and maybe do the presentation, then kindly take it away and start the presentation. Welcome.
Thank you, Arthur. Thank you very much. Hi, everyone. Good afternoon. My name is Christine Wasale, coming to you from Kenyatta National Hospital, Department of Laboratory Medicine, Histopathology Lab. Our topic today is turnaround time in histopathology lab. We want to try and understand why is histology so unique from other tests. Why do you get to a histology lab and you're told that today with a histology sample and you are told that your sample will take, some people will give you maybe 3 days, some people will give you 8 hours, some people will give you 2 weeks. Yeah, we want to understand what are these factors that affect the TAT in a histology laboratory that standard like any other test, which it takes maybe 2 hours or 1 hour. You'll find that histology will always, it has like different TATs in different laboratories. So today, we just thought it's wise for us to try and understand these factors that affects the TAT, that makes the TAT to be different in different laboratories, and all of them are processing tissues or biopsies, and the process most of the time are standard. So today, we are going to try and look into that. So the objective of the day is just to understand the factors that affect the TAT in a histology lab and how to try and improve this TAT in this lab. So just a brief definition. Histopathology is a branch of pathology focused on the study of tissues to identify diseases, particularly cancers. It can be used to diagnose other diseases, the microorganisms. Histology is mostly interested in cancers. So histology TAT is the time frame from the time sample or biopsy is received in the lab to the point a report is released. That's what we define as histology TAT. And why is it important? Turnaround time of any laboratory is important for customer satisfaction, because the doctors are depending on this TAT for them to make a decision. The patients will always depend on that TAT for them to know their condition or their status. So TAT is very important for customer satisfaction. Among other factors, it's very important for customer satisfaction. Then another importance for TAT is TAT is a quality indicator for the laboratory's performance. We will always look at it. If you want to see if your laboratory is functioning optimally, it's adhering to the standards, TAT will be one of the factors or indicators that will be measured. So to start with, let's just try and understand some of the specimens that are received in a histopathology laboratory. So we have the incisional biopsies. Those are just biopsies that you'll just go in and take part of the tissue, not the excisional biopsies. Sorry, excisional biopsies, that is the type of biopsy that you will have to take the whole tumor or the whole lump outside. You remove the whole tumor or the whole lump, then you go and you take it to histology lab for assessment. That is excisional. Maybe like there's a lump that is in the breast, so you go into the breast and take out the whole lump. That is excisional. Excisional biopsies is just taking part of that particular mass or lump or tumor. You just take part of it. Like for a good example here are the core biopsies. Just go in and take part of it for analysis to decide whether it has to be excised. For masses, you will go in and take like you do an excisional biopsy and you go to the lab, maybe a breast lump, and then find that it's just a fibrofatty tissue. That one, there's no need of removing it out, so you just leave it there. If it doesn't, they say if it doesn't bother you, don't go you don't go in to excise it. If it bothers you, you remove it. Then we have the punch biopsies. mostly this one just using, there's that, they are just a small cylindrical type, cylindrical kind of tissue that is mostly skin tissue that is removed using a circular tool. Then we have the curettings. These are samples that are normally obtained through the D and C procedure, the dilation and curettage procedure. And mostly just go mostly they are from body cavities, and particularly the uterus. And you go in with the accurate, there's a tool known as, or an instrument known as accurate, that is spoon-like, that you just use to either scrape or scoop samples from the cavity, that is the uterus. So most of the time you'll find that the curettings are from the uterus. Then you have the chef biopsies.
Madam Christine.
Yes.
Some of our participants feel that your audio is a bit low. Are we able to get closer to your gadget, or maybe you increase your audio?
Okay.
Yeah.
Let me try and increase the volume. From your side, do you think I'm very low?
From my side, it's okay, but maybe from our members who are also listening.
Yes,
They have issues with your volume. They believe you are a bit low. So if you're able to increase, it will be better for us.
Okay, let me try and be more audible.
Okay.
So, okay, we are just trying to, I was trying to talk about the types of biopsies, and we had looked at the curettings, which I said that those are samples that particularly are taken from the, through the D and C procedure, that is the dilation and curettage procedure, whereby you use an instrument called accurate. Accurate is used, which is just something like a spoon-like, is used to scoop or scrape samples from a body cavity. And mostly this body cavity is mostly, in most cases, we do it from the uterus. Then we have the chef biopsies. These chef biopsies are also, they are just like, whereby you just use a blade to cut some, maybe a swelling, or maybe you cut a piece of a skin tissue. Then we have the wedge biopsies as well. Those ones can be also from maybe the skin, the liver, the biopsy. Yeah. So these are the kind of biopsies that will be received in a histopathology lab. So this kind of biopsy that you're going to receive in a histopathology lab, apart from the number, the workload, they'll also affect the TAT, because if the biopsy is a small biopsy, the time it takes to process that biopsy, you cannot compare it to the time it will take to process a complex biopsy. Like for instance, you're having a mandible, a whole mandible, or you're having a mastectomy. So the time you will spend processing the small biopsies will be different from the TAT for the big biopsies. So some of the factors that will affect the TAT in a histopathology lab, we have the analytical factors. These are the factors that factors before processing. In some of the cases, you'll find inadequate clinical information. So you'll find that clinical information provided is not logical review of that case. So the
Yes, hello, Madam Christine. Your voice has disappeared. You're not able to hear you totally for now. Are you able to hear me? It seems participants, are you able to hear our speaker? It seems we have lost her. Yes, it seems we have lost her. So just in a moment, I need to.
Hello, are you able to hear me, Arthur? I'm able to hear you.
No, we were not hearing you. We're not getting you. Even our participants were not able to hear you. But if you are back, it's well for us. You can continue. But then there was a question here. There's a concern. One participant is requesting that you repeat the types of biopsies.
Okay.
He's not gotten it well.
Okay. Oh, okay. That screen, right?
Yes, exactly.
That screen. You are able to hear me now?
Yes, I'm able to hear you. I hope you will not disappear again.
Am I audible enough?
From my side, yes.
Okay. So these are, sorry for that. I'm not so sure what is happening because my network is perfect and I can hear you guys, but I'm sorry for that. So the specimen types received, the types of specimen received in a histopathology laboratory, we said we have excisional biopsies. Excisional biopsies, this is whereby the whole mass or the whole lump is removed. You go to the doctor and maybe you have done a radiology test, you are feeling a lump somewhere in the body, and then they decide to remove the whole lump. We can call it excisional biopsy. Sometimes we can call it a lumpectomy. It can like you're removing the whole lump or mass together with some borders or the margins. Those are excisional biopsies. Then incisional biopsies, this is whereby you go inside the lump or the mass or the tumor and that's just a piece of it, just a small sample of the lump or the tumor or the mass. That is incisional. And a good example for incisional biopsy is a core biopsy, which is taken using a core needle biopsy. Then we have the punch biopsies. And the punch biopsies, these are whereby this is just some small cylindrical type of tissue, mostly skin tissues that are removed using a cylindrical tool. And then we have the curettings. Curettings, these are samples that are obtained through the D and C procedure. D and C means dilation and curettage. And it's normally obtained using a curette. Curette is an equipment like looks like a spoon-like. And it's used to scrape or just scoop those tissues. So these tissues are mostly from cavities, and in most cases, they are from the uterus. And then you have the chef biopsies, and those chef biopsies are just using a blade to cut a small piece, maybe of a swelling outside the body. And it can also be a skin biopsy. And wedge biopsies, just a part of the biopsy, not a core, but just a part of it, like it's a little bit bigger than the core. It can be from the liver. You are taking part of the liver, part of the lung that is affected. So that is all on specimens that are received in histopathology lab. And I've said the kind of specimen that you're receiving in a histopathology lab will affect the TAT, in that if you're having a smaller sample, you cannot compare the smaller sample to the to when you're having a big sample like a breast tissue. The time it takes to process that sample is smaller, or it will be less than the time it will take for big specimens. Then we have affecting our TAT. We look at the pre-analytical factors. Analytical factors we're having first, our number one here, inadequate clinical information. And here, sample has come and the sample and the request have been delivered in the lab with some information missing, and those information can be essential. Maybe you just got a biopsy can be like you just got biopsy, you don't know where the biopsy is coming from, which part of the body that biopsy is. You don't know, have any clinical information, which might be key in the pathological review for that particular case. So you'll find that the pathologist had to call again the clinician to find the details for that particular case to be completed. So that one might impact on the TAT negatively. And another thing is incorrect registration or lab accessioning. So when you're having incorrect registration, the samples came with the request, but the person who was doing the accessioning made some errors. We are all human and we are prone to errors. So errors in accessioning, or even during the grossing when you're doing the writing the cassettes and you make errors, that one might affect the TAT4 samples, because you'll find that there are some mix-up. Like for instance, you're having like 3 breast tissues for biopsies, or like, let me use just biopsies or uterine biopsies that are, all of them are having the same consecutive numbers. So you'll find that these numbers, when it comes to reporting and there was a mistake that was made in the mix-up during the registration or the cassettes writing or barcoding of the cassettes, when there's a mix-up, you're not able to sort out that mix-up easily because all the samples are the same. Yes, so it's always good for you if you're having like that. For those receiving bulk samples, so many samples in a day, make sure that the samples, when you're having gastric biopsies or cervical biopsies, make sure that you're not giving them numbers consecutively. You can do like a gastric number 5, then you skip 2 numbers, give the rest like breast, and then you have like a prostate biopsy, and then you come again, give another gastric. That way, when there's a mix-up, even during reporting, you'll be able to sort out. You're having 2 numbers, two cases with the same number, but looking under the microscope, the other one is an OGD, the other one is a prostate. It's easier to sort out. So that is very important. Then another thing is the quality of the samples. Some samples are received and fixed. When you receive a sample that is not fixed, you cannot proceed to crossing and processing. You will have to give it another day for it to fix. And that one is going also to affect the TAT. So make sure that when the sample, make sure that people in theaters, people taking samples, they are given enough, they have enough information on why fixation is very important. The samples should be delivered fixed, and that one will reduce the TAT. Who a fixed sample will need more time for fixation. Then logistics, maybe this transport delays from the clinic or the lab, or clinic or theater to the lab. The sample has been taken today, and instead of being delivered, it has been forgotten in theater. It takes another 2-3 days in theater before coming to the lab. The client in the ward knows that my sample was taken and I was told that TAT is going to be 10 days. You see, that one already, the delay has already the TAT, because when the lab sample is coming to the lab is already 3-4 days late. So that one also affects our TAT. So another thing that will affect our TAT in the lab is the type of specimen and its complexity. I've just mentioned that small and soft biopsies, they'll short time to fix and process. If you'll hear some, when someone working in a laboratory tells you that they'll give you a result in 6 hours or 8 hours, it's possible. And because it depends on the biopsy, type of biopsy, it's possible to get a histology result within the same day, provided you have a pathologist to report it. It's very possible, because a gut biopsy takes a very short time to fix. Around 1 hour, it's already fixed. Then processing, within 3 hours, it's already done. Then you'll have to go ahead and embed, and then do microtomy, stain, and the pathology reports. So it's very short time. It's possible to get a histology report within 8 hours. Within 24 hours, it's possible. Now, whether you're having 5 or 10 samples and they're just small samples, it's possible for you to give a date of 24 hours. If you're having complex biopsies like on my screen right now, you can see that is a breast biopsy. That is a mastectomy. This one moment, it will not fix for less than 6 hours, because the moment it's delivered in the lab, even try to go and try to to gross it, it's still raw. You'll need to give it more time. Even after grossing, you need to give the tissues and cassettes more time for them to fix well. Because I once mentioned on this platform that there's no remedy for poorly fixed tissues. Everything will just be a mess. So a mastectomy will take time. Unlike the small biopsy that will just go in, even a scientist or technologists just go in and do the grossing. All you need to describe 3 tiny tissues aggregating to 5 millimeters, all processed in one cassette. That's okay. For this one, you'll need to do it together with the pathologist, describing the margins, getting to measure all the measurements, describing using the 5 C's. Then from there, we'll have to, sometimes they proof it, give it more time to fix so that it can be crossed the following day. Sometimes you'll have to gross it, but leave it for further fixation. So large and fatty tissues, of course, will take more time to fix and process. And this one, I cannot lie to you that someone will tell you that after mastectomy has been taken, it will take them 8 hours to give you the results. That will not happen. It won't. It needs time. Even for processing, it will need enough time for them to process. Another thing is the type about the type of biopsy. In you're having the hard and bony tissues, like you're having the mandibles, you're having an amputation, an above knee amputation. This one you'll need more time for them to decalcify. You're having bony tissues. They have to decalcify first for you to gross, then process. So the TAT will also be prolonged for these particular tissues, the bony tissues. Tissue processing, time required for the following steps also will also matter, because for you to gross a small specimen, you not need even for five minutes. For you to gross a whole mastectomy, you can imagine you'll need more time. So if you're having a lab that is standalone and is telling you that it is 2-3 days, it's possible, the kind of specimens they're getting. Then you have another lab that is in an institution whereby you're getting this complex kind of tissues every day. And then grossing alone, like you can gross the whole day. You spend the whole day grossing because it's a batch. You have to gross it the whole, like all of it. Then again, those big samples need more time for fixation. Processing, still the same thing. You cannot process a breast specimen within 3 hours. No, it will need more time. Then embedding, if you're having 5 samples that are OGDs, you'll embed them in 10 minutes. But if you're having 5 breast tissues, embedding will take you approximately maybe, almost 1 hour, more than 1 hour, 2 hours. Because if you're having 5 breast tissues and each breast is having like 25 slides or 30 slides, 30 cassettes, it means you're having 150 cassettes for only 5 samples. So again, you'll feel time. Sectioning and microtomy is still the same thing. The lesser the samples, the lesser the time it will take. The more the samples, the blocks, the more time. Staining, still the same thing. If you're having less samples, staining will take you, you just need a 1 run. Whether you're using automated stainer, an auto stainer, or you're using manual stain, you just do 1 run. Or you're doing, you have an auto stainer, 1 run. If you're having an auto stainer and you're having 300 slides or 400 slides, the slide holders, those slide holders will normally carry 20 to 30 slides per rack. So you'll find that you'll do at least maybe 10 runs for the staining to be done. And each run is taking approximately on the lower side, approximately 15 minutes for each run to be done. So the less the work, the less the time it takes, and the less the TAT it will take. Workload. And this one relates mostly to the previous slide. the average number of samples received in a histopathology lab. I have a standalone lab, and there's a lab that that is working. There's a lab in an institution, histology lab in an institution that is very busy. So you'll find that my standalone lab, I don't have a theater. So I'm depending on my marketing to get samples. So you'll find my workload in a day, I get around 5 or 10 samples. And there's that histology lab somewhere, whereby the samples are average of 6 or even 8 per day. That workload, the TAT will affect the TAT. Samples and testing 60 samples, of course, you cannot compare the two. Then,
yes, Madam Christine,
I'm looking
again. Your voice seems to have gone low again. We request that you restore your voice so that it's audible.
workload. Is that okay? Hello?
Yes, your voice is still low. We're not able to hear you well.
Just a minute. Let me see. Hello? Hello?
Yes, yes.
Hello? Are you able to hear me now?
Yes, but it's still low. It was okay, but then it started going down, and so we're requesting that you can restore it to where it was initially. It was a bit audible.
Hello, hello, hello. Is that fine, Arthur?
Yes, yes, we can continue.
Okay, thank you. So on the workload, this increased workload will of course lead to delays and backlogs in all stages of tissue processing. When the workload increases, you'll find that even if you are used to processing 300 samples in a day, and the workload goes slightly up, you'll find that there will be, of course, delays. The workload will impact on the backlog, will delays and backlogs in all stages of tissue processing. You are used to doing only one run overnight, then you have to do one run at night, another run during the day. So workload also impacts, affects the TAT. Another factor that will affect the TAT is staffing. The staff working in a histology lab should be adequate to handle the workload. Both technologists and scientists and pathologists, including even the secretaries that will type the reports, they should be adequate. Because if you're having adequate pathologists, but the secretaries are not adequate to type the reports, they will be backlogged in the typing. Your reports are being released, are being reported, the cases are being reported, but they're not being typed because of the understaffing in the of the secretaries. The technical team should also be adequate to handle the workload. If you are used to maybe a technologist is used to doing 250 blocks microtomy per day, and then you're telling them to do 500 per day, of course they'll be worn out and they'll not be able to deliver. Then adequate training and competencies. The technologists, they should be adequate to handle the workload, and they should be having adequate training and competencies. Because if they're not competent enough, or they're not well trained in histopathology, they'll not be able to produce tissues or sections of good quality. And that one, they will impact on the TAT negatively, because the cases will still come back for beta sections. They're being dispatched for reporting, and they're coming back for beta sections because the quality of sections is poor. So they should be having adequate training and be competent enough to handle histology work. Then commitment and dedication. This is whereby you're having 50 samples and a pathologist and a technologist or a scientist are being assigned that particular workload. And you'll find that the pathologist at the middle of grossing, they decide that they're tired. They don't want to finish that workload. They say that we are going to leave the remaining samples for tomorrow. Tomorrow, there's another workload for that particular day. So maybe they'll not find time to gross the remaining work tomorrow. So that work again has to go an extra 2, 3, 4 days before the work is grossed. That one will also impact negatively on the TAT. The team, both pathologists, the technologists, the typists, the health records officers should be dedicated and committed to work together for the better, for them to release the patient's results within the given or specified period of time. If you are not committed, of course, there will be delays, and that one will affect our TAT. Then another issue here is manual versus automation. We are in the digital world, and and nowadays most of the processes are being automated. So if you're doing your processes, your processes are automated. Of course, automation will reduce the TAT maybe with a day or two. If you are doing manual, we all know histology is not an urgent test like the UECs or the hemogram. Is not an urgent test. So in most cases, you'll find that histologist labs do not operate during the night. They operate mostly during the day. So if you're having, if your processes are automated, then after grossing the samples, you will leave them to process overnight. That is automation. It reduces because rather than you coming the following day to start processing manually, you process overnight. When you come the following day, you start blocking. You see, it has reduced your TAT by a day. And again, when it comes to the staining manually, especially the cover slipping bit, it's very tedious. It takes a lot of time, especially if you're having a lot of samples, slides. The cover slipping bit is very tedious. But if you're doing it manually, you'll find that you have reduced the time you'll have taken to process by almost half. So if you would have left the samples there to air dry and dispatch tomorrow, you will be able to dispatch your samples today, your cases today, because the autostainer is doing the staining and cover slipping for you. So automation, of course, reduces the TAT. And manual takes more. Manual processes takes more. And another thing I realized with automation is that for the cover slipper, I think the amount of the amount of DPX that is being dispensed is very predetermined. So you'll find that the slides, when they're coming you remove the slides from the machine, they are not like dripping wet the way we normally find, the way they normally look after manual cover slipping. You'll find that when the slides are cover slipped manually, and the ones that are cover slipped in the automated machine, the auto stainer and the auto cover slipper, you'll find that those ones, when they come out, you cannot even realize that the DPX has been added. It's always predetermined. So of course, automated processes will always reduce our TAT. So if you can automate your processes. There's image on my screen. This is just a manual staining platform from DACO. Then another our TAT is reagents. Machine breakdowns. If you use automation, then your machine breaks down. Of course, that will affect TAT, because you'll find that people will either resort to manual process, to an auto processor, go home overnight, come back the following morning,
Yeah, kindly check on your audio. Your audio has disappeared again. We can't hear you. We can't hear you.
Hello. Are you able to hear
Yes,
me?
you are now back. Please continue.
The same slide or the previous one?
The previous one, because you disappeared, I think, a minute ago.
Yeah. The previous automation versus manual. You are able to hear me? Kindly guide me.
Okay. Proceed.
Okay. As I had mentioned earlier, automated processes will always reduce our TAT. For instance, processing. If you are processing manually, you'll need to do it during the day when you are there. But if you have an auto processor, that means you can process your tissues overnight. You can leave your tissues overnight, and then when you come the following day, you just proceed with blocking. So the TAT will have reduced that auto processor have reduced our TAT with 1 day, a whole day, which is a very big impact. Then if again, when you go to staining for the blocking and microtomy, the automation doesn't impact so much because you are still there as you are using the staining, the embedding module. You are there doing the work. Then our stainer will also reduce our TAT by at least a half the time it would have taken, especially the cover slipping bit, because the cover slipping bit that process is very tedious, takes a lot of time compared to when you're doing it using a machine. So the time would have for you to stay in using the manual process will reduce by almost a half if you're using an auto stainer and the cover slipper. Then this machine here, this is a staining platform, the manual staining platform from DACO. Another thing that will impact the TAT is equipment and reagents. The machine breakdowns and reagent stockouts, some reagents getting expired, that will also affect TAT. So for machines, make sure the machines are always maintained. The one that is on my screen, that is a blocking station. If you don't maintain this blocking station, you'll find that the filters will be clogged with wax. So make sure always that you clean the machine well, even the processor. Make sure the reagents inside, you change them regularly, maybe once or twice a week, depending on the workload, and you clean them. The machine are maintained to minimize on the breakdowns, because when the machine breaks down, it will affect your TAT. You'll either be forced to go back to manual method or wait for the machine to be repaired. And when you're waiting, that process of waiting, you're wasting time. If your blocking station breaks down like the one that is here, if it stops working, this one, because it's a blocking station, it's almost manual because you are there doing the work. So if this one breaks down, maybe the wax is not able to melt. You'll need to wait you'll need to wait as an engineer comes. Because the other way is for you now to start having heated wax in a bath, and then trying to get a plate that you'll be using when this machine is being repaired. So you see that hassle will always affect your TAT. Another thing is reagent stocks. Always monitor your stock. Do your stock always to make sure that you have enough and adequate stock for to meet your needs. Don't wait till you're having only one container of xylene or alcohol for you to start ordering, because before it comes, for those of us who are working in institutions whereby the due diligence has to be done through the supply, the system, the supply, the supplies, you see, it will take a lot of time. So make sure you monitor your stock and then be sure of your reorder level. So you know that when I am having 3 containers of xylene remaining, I have to be ordering another one. This one will take me for 2 weeks as I wait for that one. Know your stocks and it will help you save TAT. Then availability of LIMS, this laboratory information management system. This one is very key when it comes to histology, because not even histology, all the labs, because sample tracking will be with ease. You're looking for a case 305. For you to know where it is, you can go to LIMS, then you track it. If you don't know, you start going manual. When was it grossed? Who grossed it? Where is it? Who, like, which pathologist is having the case? So that hassle of looking for things like manually will save you a day when you're having LIMS. Another example here, maybe imagine there's a biopsy that client works in the lab and says that I did a biopsy in 2023. I'm not sure of the month. I'm here for the results because the doctor needs it, because that problem that I had that time has reoccurred. If you're having LIMS, it's a matter of just a press of the button, and you'll be able to get that particular report for that particular, then you print. If you don't have LIMS, you'll have to go to look for that manual register that was being used in 2023 and start going through the register manually, looking for a name. So that one, if you are the technical person that was on the bench and you are still going to look for that particular report, actually the information details, for you to get the lab number that was used for that patient, it will take long. And that one is also affecting your work on the bench. So your work on the bench has stalled. It's just like has stopped for you to attend to this particular one. So in availability of LIMS will always save time and shorten the TAT. Another thing that will affect a turnaround time in a histology lab is the nature of the nature level of the institution. If you're having a standalone lab, you cannot compare the TAT for that standalone lab to a laboratory that is in a teaching and referral institution. Because this teaching institution, people working in the teaching and referral institutions, they have a mandate to teach students. In histology lab in particular, we are having the MED pathology students. Those are the pathology registrars. We are having the diploma students, degree students, master's students for MLS. So these registrars, the only way they can learn is from that pathology lab. So they'll have to be there to learn. They have to be given a chance to learn. So when I tell you my TAT will be 2 weeks and somebody's telling you the TAT will be 3 days, it's because we are giving these students chance to learn, because they're our future pathologists. If they're denied the chance today to learn, where will they be able to learn? So you'll find that during grossing, the registrars will always perform the grossing first, being taught. Then after the processing, then you dispatch the slides. The registrars are also given the chance for them to screen the slides first, then they sign out with a consultant. So maybe during signing out, the consultant realizes that there's a point, there's some area of interest in that particular tissue that the registrar did not sample missed. They'll go back to the gross specimen, grossing, again cut that area of interest, regross, they regross it. And then that particular, those tissues that have been sampled, they have to be processed again, embedded, sectioned, stained, again then reported. So you see this back and forth. And it's not their fault, they are learning. So the nature of institution again matters when it comes to TAT. If it's a standalone lab, there are no students there. So they're just given, the process is just straightforward. So the nature of institution will also determine the TAT, the turnaround time. If it's a teaching institution, of course, it has to take more. Even for technical staffs, the MLS students, when you're doing the microtomy, when you're doing the embedding, you have to show them slowly how you are trying to embed, to orientate the tissue in a mold so that you get the area of interest is sampled during sectioning. They have to learn and actually give them a chance to do 1, 2, 3. That one, of course, again, will delay the time you would have taken if you are just blocking alone. When you're having students, even staining, you have to explain to them, why am I doing this and why am I not doing this? So the level institution has also will determine the TAT. Then another thing that will affect TAT in a histology laboratory, the ancillary studies. Those are just the standard technique has been performed, and the pathologist has looked at the slide. There's what you call ancillary studies. Those are just additional tests. They can be histochemistry or can be immunohistochemistry. Histochemistries are just like like H&E is a histochemistry. So they can be additional histochemistries. We normally call them special stains in a histology lab. You have done your routine, your standard technique, the H&E, and then you have dispatched the slide to the pathologist. Looking at it, they feel this one it's pointing towards TB infection. So there is a need for you to do a test for TB. So they'll request a test for that particular, for an additional test for them to be able to give a clear diagnosis. I was just trying to argue with some learned friends in the field. Just the other day, they were trying to ask why we call them special stains. Why are they special and yet that it's the right thing to be done? And the answer is, yeah, there's stains for us. People working in histology will agree with me that special stains with us, even James is a special stain to us because this particular stain or histochemistry, it's able to outline elements or organisms that are not able to be identified using the standard technique, which is done using the then
Yes, Madam Christine, check on your voice. Your audio has gone down again. Kindly restore it.
when did I just right now?
Yes, just right now.
Am I audible?
Yes, continue.
Okay. From the slide, right? From the same slide.
Yes, just continue from the same slide.
Okay. Another aspect that will affect our the ancillary studies, those are just additional tests. There is study H&E, and I was about stains. Just additional chemistries. For us, I've just said there are special stains because they're able to highlight or identify elements like the ion stains, elements or organisms that cannot be identified using the standard technique, which is H&E. For instance, the pathologist is suspecting TB infection. In most cases, they'll request Zden, Zil-Nelson. One I've written it there just because it's the one that is normally requested. But everyone working in histology, we know that you don't do Zden in histology. The test you're doing for TB in histology is Kinyun, and in some cases we are doing Faraco. Kinyun is the cold method, just a modification of Zden. Then requires the use of heat, of which in most cases we don't do in histology, because the reagents that we use in histology, especially the xylene, the dewaxing, they're already harsh, damage the microbial wall of those microbacterium. So further heating will just damage that wall. We don't really recommend heating in histology when you're doing the test for TB. We recommend the cold method, the quinone. And I think this is the test that the pathologist should be requesting when they are interested in TB infection, not Zeden, because they request for Zeden, but we end up doing quinone, the cold method. If it's gastric biopsies, because of H. pylori, mostly we are doing GEMSA. Those are just additional tests that will require additional time. Maybe after dispatch, the slides, the case is brought back for additional stains. Warthin study, hospirochest, or even also the high H. pylori, PAS. This one mostly is done for mucins and also fungi, mesentericrum for collagen, fibers, the grocots for fungal, the fungal stain, the pulse Prussian blue, which is an iron stain, then retic for reticulin fibers. Another ancillary study that is normally done in histopathology is immunohistochemistry. Immunohistochemistry, immuno. That is, immuno means antigen antibody reaction. Histo is tissue, then chemistry. The chemistry of antigen antibody reaction in tissues. This is a laboratory technique that uses antibodies to identify and locate specific antigens in tissue samples, helping to diagnose diseases like cancer and understand cellular function. And this allows pathologists to distinguish types of cancers and diseases by visualizing the presence, location, and quantity of specific molecules under a microscope. You've done your histology, you've displayed a slide, a breast or a brain biopsy, you go to the doctor has looked at it and says, this one looks malignant. Another thing I need you to note here, standalone lab will tell you the TAT is 3 days, and they will do that, they'll process that core biopsy from the breast. Then they'll give it to a pathologist to report. Then the pathology reports invasive ductal carcinoma. And then the report is typed. And then it's released to the patient. They are happy their TAT has been met for 3 days. They're not helped the patient. Because that report is incomplete. You have to do IHC. Because this patient will take that report, that the report was out within 3 days. They go to the clinician, and the moment they step into the clinician's room, the clinician will, and they have paid for consultation, the clinician will just tell them, go back to the lab for additional tests, and that is immunohistochemistry. The patient comes back. You see, they have not been managed. Nothing has been done. They're coming back, and when they're coming back, or now they're going back, they're going to another facility which can do immunohistochemistry. If you are in a laboratory that can perform immunohistochemistry, you'll realize once a doctor has identified that this particular case is malignant, they'll request for IHC markers before they release the report. So those IHC markers, they'll take another 2-3 days for them to be out. So that one will also affect the TAT. So when someone is telling you our TAT is 2 weeks, 10 days, in most cases, they have factored in everything, including this IHC. And when I tell you my TAT will be 3 days, I might have not factored in the IHC part of it. So that is, I hope you are trying to understand why the TATs we are being given, they're normally different. This is just an automated machine performing IHC. This is what we have this the Benchmark Ultra, we have the Benchmark XT, we have the Benchmark Ultra Plus. They are in different models. But this one, you can see here, if you can see where I'm pointing, this is where the slide holders are. You press a button here and all of them will open, and on inside we'll see the thermopads whereby the slides are here. When they open, you'll see the thermopads where you can place your slides with tissues. And up here, you can open just here when you press, when you open these here upwards, it will open and you are able to put your reagents and antibodies there. And then here, these are the bulk solutions, the ones that are used to wash the slides, the liquid cover slippers. Here is where the bulk solutions are. And then here, this door, you can open it. You can see here, you can open it and here, this is where the waste is. So you're able to check when the waste container is full, you can just discard it. And then there are normally two. And then this particular machine works together with a screen, and you have the barcode printer that you print your barcodes and stick on the slides. And then the machine will be able to read the barcodes on the slides and identify the test that is supposed to be done. Then after you have done everything in a histology lab and you have dispatched your tests, we have the analytical factors that will affect the TAT. The sample, the slides were given, the pathologist looked at it, but maybe the pathologist feels that he or she needs to consult another pathologist. If it's a case that requires some level of specialization, you'll find that if it's skin biopsy, in most cases it will require a review of dermatopathologist. So you'll find that you have to look for the dermatopathologist where they are. In most institutions, they have one, or somewhere they refer. If it's a brain tissue and you are finding it's difficult for you to report, the pathologist finding it's difficult to report, they'll have to consult a neuropathologist. So that one will also take time, because you don't just find them like where you are. You'll have to maybe call them, ask them where they can be found. So that one will also affect your TAT. Another thing is the second opinions. I've looked at it, I feel it's this. Pathology says no, I've looked at this, at this case, I feel it's this, but let's look at it. Second opinion, they feel that it's case, and consultation is widely recommended in histopathology. In pathology, it's very wise for you to take a second opinion rather than giving a wrong opinion. Then we have another thing that will delay our report is delay in report authorization. The case has been reported, the pathologist reported that the secretary have done the typing, then they came back for authorization, but the pathologist wanted to authorize it. Again, it's no. Again, another thing, but all this just goes back to pathologists have
Check on your voice, please.
hello.
Yes, are you able to restore it back?
Hey, you're able to hear me?
Yes, you're now clear. Continue.
Yeah, pathologist, the pathologist. I was talking about education from all players.
Yeah, your voice has disappeared again.
Sorry. And right now?
Yes, you're audible. You're audible.
Yeah, the pathologist review, consultation, second opinion, delay in report authorization, all that points towards commitment. Even if you have to consult and you're committed, you can be able to find that consultant that you need to consult as soon as you need them. So it's all about commitment, knowing that this report is being weighted by a client somewhere. it's always good for you to work within specified time. If you know my TAT is 3 days and I have to consult these particular cases, this pathologist should be able to try and work within those 3 days. Try and see which cases are for second opinion and make sure they are forwarded to the relevant pathologist. Then another thing that will affect TAT is the system issues, system downtime, slow reporting, software, and all that system issues, apart from the analytical factors. So it's always important to ensure that you have an IT expert on standby that you can consult the moment you realize the system is down, so that they can come in handy and resolve the system issues. And after saying all that, I think it's a chance for my chance to welcome any concerns, any questions, any clarifications from my viewers. Thank you very much.
Thank you so much, Christine, for a very vast and comprehensive presentation on matters histopathology. And therefore, we are waiting for questions from our participants on our chat box so that we can continue answering them. We urge participants to give out the questions in the chat box so that we can answer them. So far, we have got statements from the participants. Paul Kaburu says, great presentation. Nicholas Mwangangi, information well presented. Siden Moranda, no, she's written something, but I don't know what she wants you to elaborate, but that is what she's written. But most of the statement you are getting are not questions. We have what Mwalimu Ki Gunge, and he says very insightful presentation. John Wahome, great and wonderful presentation. And Gachudhi, thanks for the great presentation. We have Khalif Gure, and Khalif Gure has got a question for you, Madam Christine. And he's asking, are our roles still restricted to mounting? So that is a question to you, Madam Christine.
Maybe if I try to understand what he's trying to say, if our role.
Are you able to increase your voice? Are you able to increase your voice?
Let me try. How about now?
You are still low. Your voice is still low.
About now?
Can you do better? Not at all.
Supposed to hear me again? Still?
Yeah, that's better. Can you proceed?
Can you hear me right?
Yes, that's better. We can proceed.
Yeah, if I try to get his question, he's trying to ask if the scientist or the technical team, their roles are restricted to mounting, meaning that they can only do the grossing process, my embed, microtomy, and then stain, and then mount, then dispatch the slides for pathological review. I think that's what he meant. If the farthest we can go is mounting. I'm trying to think that's what they meant. Unfortunately, yes, dear. You, as the technical person, our training does not allow us to report slides, especially histology slides. Cytology, yes, but histology, unfortunately, yes, they're not. But for the small stains, maybe you can look at them because you're able to tell what TB is. But pathological diagnosis is histological diagnosis, no. Unfortunately, yes, dear, that's the best we can do. Up to mounting, you mount the slides, then you dispatch. The rest you leave them to the pathologist. They have undergone training for that. So unfortunately, yes, I know it's discouraging, but yeah.
Thank you. We have another question. We have another question from Anne Mwaniki. And Anne Mwaniki says, wonderful presentation. And the question is, if the lab does not have a histopathology lab, which is the best preservative or fixative for transportation? Back to you, Christine.
Yes, 10% buffered formal saline works best. Just the normal buffered formal saline will do. And thank you for asking for that, question, because most, having worked in a or working in a referral lab, most of the samples we get from the satellite labs, they come unfixed or they come in saline. And in most cases, when they reach the lab, they're already autolyzing. So just use the normal 10% buffered formal saline for fixation. But yeah, for histology, that's okay. Yeah.
Thank you. Another question from Daniel Obwaya, and it starts with an observation. And he says, excellent presentation, though audio was up and down. So the question is, what's the best time required for tissue processing after biopsy removal? And a concern may be a tissue was in processing and the machine breaks down after amendment of the machine. Is the tissue viable for processing continuation depending on TAT? I don't know if you've heard the question or I can repeat.
I think I heard it.
Thank you. Thank you. Thank you.
I think I heard it. For the mic, I apologize.
Check on your audio. You're lost again. You are lost again. Yeah, your audio is lost again. We're not able to hear you. You're still very low. Not yet, not yet restored. Yeah, probably you can continue.
Okay. There's no best time for fixation, for processing the tissues. You can process the tissue during the day, you tissues during the night, provided you are sure that your tissues are well fixed. If you have received tissues that are very small in size, those small samples, and you have time during the day, you can process them, whether manual or automated. There's no best time for processing, provided the tissues are well fixed. Then the hiccup, when the machine, the auto processor stops during processing, and then you come in the following morning, you find that the processor stopped mostly there are some stages when the processor stops, they're not be able to affect the quality of tissues. If it stops in the first or the second alcohol, they'll not be able to affect the tissues so much. They'll not affect those tissues. even if it's the third or the fourth alcohol, don't have, they'll be dehydrated, like properly dehydrated, yes, they not be so you just correct your machine, then you continue clearing. But if the machine stops in the xylene, especially if you're using xylene as a clearant, if the machine stops in the xylene, don't proceed with the processing. Only reverse the process, and reversing just going back. If xylene 2, go back to xylene 1, then alcohol, absolute alcohol, just go back, then start again. Because if you don't go back, xylene will make those tissues to be brittle. They'll be very brittle. And I wish you, I hope you understand when I say they'll be very brittle. They'll be crystal-like. When you're sectioning, those tissues will be like crystals. So they'll not give you good quality sections. So if the machine stops in xylene, xylene will make the tissue become brittle. So it's good, it's advisable you go back, you reverse the process. You just reverse the process to the first alcohol, then start again. It works perfect. If it stops in paraffin baths, the best. There's no harm for over embedding the tissues because it's just meant to give the tissues internal support. But if it stops in the xylene, it's where the tissue, the problem will be. If it stops in the last alcohol, please kindly go back to the first alcohol, which is around 70%, then start again, because that one can over harden the tissue again. Yeah. Hope I've answered you.
Yeah, thank you. Let's proceed. Another question from Anne Gachude. And the question is, kindly, how many slides are prepared for the whole process, including repeats? Back to you.
I don't slides prepared for the whole process. Yeah. Like slides. Okay. I think
the question was from Anne Gachude. The question was, kindly, how many slides are prepared for the whole process, including repeats? I don't know how you're able to understand that particular question.
Okay.
Yes.
Okay. For the first of all, you will only be able to quantify the slides if you know the type of specimen you're having. Because if you're having a small specimen, a core biopsy or an OGD, you only have one slide. You just prepare one slide for HNE, and if it's an OGD, an additional slide for DMSA. That's all. If you're having a mastectomy specimen, it will depend with the pathologist grossing. You'll find some pathologists that are giving you up to 30 or even 40 slides, depending on the kind of tissue. And then if it's another thing that affects the number of cassettes that are prepared during grossing, if you're having so many lymph nodes, the lymph nodes that are able to be harvested, because they also want to know if the disease is already invading other, it's metastatic, it's invading other areas. So, of course, we know the lymph nodes are the most of the diseases metastasize through the lymphatic systems. So the lymph nodes, if you harvest more lymph nodes, the more cassettes you'll be having. So it will depend on the kind of tissue here. If you're having a smaller biopsy, just one slide, maybe an additional one slide, even if there is a recut. But if it's a mastectomy, you'll find if it's being done by a registrar does it and then gives you 25 or 30 cassettes. And then going to report, the pathologist is not satisfied, or there's that particular specimen, we call it the Whipple surgery. the Whipple surgeries for the one for the pancreatic and the duodenum. The Whipple surgery, we find that most registrars, they're not able to handle it. And those that handle it, when they go back, they go for reporting to the pathologist. The pathologist will again come back because there are some areas that were not picked for recuts. So, and that one will depend with an independent pathologist, the number of cassettes the more cassettes that will be made. So the number of slides depends on the type of tissue, and the pathologist that is also grossing will also affect that, because some pathologists will go for lesser cassettes, and more others will need more. So that one is dependent with the person trimming and the kind of specimen at hand. The bigger the specimen, the more the slides. And there's another specimen in the lab, like it's not rect, it's the scrotum. And I think when you're having the scrotal CA or the penile CA, you'll find that they are grossing the entire tissue. Or even you're having a cervical CA, you'll find that the entire cervix has to be grossed. And don't be surprised if you're having up to 50 slides for one particular case. So it depends with the type of specimen and the pathologist, the individual doing it. Thank you.
Eric Atema has a question, and the question goes, what influences the cost of tissue processing? Back to you.
Didn't get it. Sorry.
The question is, what influences the cost of tissues processing? Hello, Madam Christine? You have disappeared again. Kindly restore your audio.
The question about the cost.
Yeah, the cost.
Okay, the cost, every lab will have their own way of coming up with the cost, but in most cases, you'll have to see what is supposed to be done, what you're able to do. For instance, you'll find that some people are just doing only the histology bit, just histology alone. They just do histology bit alone. So their cost is just for histology. But you'll find in most labs, we are doing histology plus IHC. So you have to incorporate the cost of IHC plus histology together, then try to get a balance. So, and then you see what you're using. If you're processing like manually or you're using automated processors, of course they come at a cost, and those equipment were bought. So you have to also do your math. So each lab, I think it will come up with its own method, but a routine histology, roughly around 3K, roughly routine histology. But those who are doing histology plus IHC, you'll find them putting the cost at around 5,000, somewhere there. Yeah. So what you're doing will determine cost.
Thank you. Another question from Margaret Jerry, and the question is, how long can a biopsy stay while in formal cell line before being transported to histology lab? Back to you, Christine.
We don't process samples in some informal in formal cell line. Formal cell line, right?
Yeah, formal cell line.
No, there's no time frame for that. So long as the samples are in formal cell line, they're fixed. And a fixed specimen doesn't go bad, like doesn't autolyze. So whether it takes a day, a week, or a month, so long as it's well fixed, it's okay. This one actually works for people working in the satellite institutions whereby you don't have a histology lab and you need to transport the samples to a histology lab. In most cases, they have to, like they batch. They batch the samples for almost a month, then they report. So long as the sample is in formal saline, it's well fixed, there's no issue. It will just be processed, not be affected. Back to you.
Thank you. Eric Atema comes in once again and he says, kindly share contacts so that you can mentor us to have histology labs. You can comment on that.
Well, okay. Where do I share my contacts? I'm not so sure about this. They know where to get me. They can get me through LMSK, right? Right, Arthur?
Yeah, that's okay. So they can get in touch with us and then we'll be able to share your contact.
Yes.
Thank you. Another question from Marceline Atieno, Marceno, and it goes, is there a time limit for tissue block meant for IHC, considering sometimes not all patients are capable of immediate payment? Back to you, Christine.
There's no time frame for tissue blocks. No. We can even do IHC for blocks that were processed and embedded last year, 2023. There's no time frame. So when the block has been prepared, so long as it has been prepared and sectioned, we don't store them in cold temperatures. Don't for some markers, especially the breast markers, some seem to deteriorate when they are stored too much for a long time in the freezer. But you don't store the blocks in the freezer. You only put the freezer when you want to section them. And after sectioning, you take them back to their archival places. So it's okay, they can be done. Because you can see even for how do I call it? For the controls, the positive controls, you take the ones that have reacted very positively, and then you can take that particular tissue, then you prepare so many blocks, and then you archive for the positive control. And I've seen it working perfectly. So there's no time frame for IHC. IHC can be done anytime, so long as the tissue was positive for that particular. It was positive, was malignant. You want to do like maybe there are markers for breast or for brain, you can do anytime. There's no time frame.
Yes, another question from Dorothy Karimi. And the question is, if one does not have formalin, what else can you use to preserve a tissue?
Formalin. And if you don't have formalin, you can freeze the tissue. Use low temperatures. You can freeze the tissue, but make sure it's not for long. You can freeze it, like you can make it frozen. Freeze the tissue, and cellular structures will be preserved. But don't let it stay like that for long. And I'm very sure within 2-3 days or to get formalin. Immediately it's removed from the body and you don't have formalin at hand, put it.
We can't hear you. Kindly restore your audio.
So how about now?
Yes. Good.
Okay.
Good.
I've said if you don't have formalin to preserve your tissues, kindly freeze them. You can freeze the tissue for around 2-3 days, up to 72 hours. I'm sure you'll have gotten formalin. Then you can defrost the tissue, then put it in formalin. Formalin or in low temperatures also delays the postmortem changes. Thank you. Ata, back to you.
Thank you. Daniel Oboya is saying that I need to repeat the last question. The last question, Daniel Oboya, that we've talked about is from Dorothy Karimi, and the question was, if one does not have formalin, what else can a use to preserve tissue? Christine, you can repeat this question to so that Daniel can understand it well. Yeah, but check on your audio, because your audio seems to have disappeared again.
Okay, hope I'm audible right now.
Yes, you're good. You're good to go.
What I said is that if you don't have formalin and you have a histology biopsy, you can freeze it. Kindly preserve the tissue at low temperatures. The low temperatures will be able to delay the postmortem changes, the autolysis. Actually, it will be able to delay the postmortem changes, but up to around 72 hours. I know after 72 hours, you'll be able to get formalin. You'll have gotten formalin. So in the absence of formalin, you can freeze the tissue. Low temperatures will delay the autolytic changes. Thank you.
Yeah, thank you, Christine. I think we've answered all the questions that were raised, and I think our time has also passed because we are at 4:31 p.m. So kindly, you can give your parting shot as we adjourn this particular presentation, so that we plan and meet tomorrow for another presentation. Kindly give your parting shot. Welcome. And check on your audio because you're not able to hear you.
About that, you are able to hear me right now?
Yes, good. Proceed.
Thank you, Arthur. Thank you, all my listeners. Thank you for attending the webinar. And from my side, I just to encourage you to keep on love to LMSK because better things are coming. And then we just want to wish all of you a Merry Christmas and a prosperous New Year. Let's meet 2026. Thank you. Back to you, Arthur.
Yes, thank you, Christine, for this quite elaborate presentation on matters histopathology. And to our participants, we will wish to apologize on the audio challenges that we had today, but I hope you are able to learn and to get much of the knowledge that was presented to us. On behalf of LMSK, we wish you the very best evening today, and we also welcome you to another webinar tomorrow so that we can learn together. To our presenter, much appreciation on the work you've done to prepare the presentation so that we can share with medical lab family in this country. We welcome you again another day to do another presentation so that you can learn as well. To our members, we welcome you tomorrow and kindly have a good evening. And as you log out, remember to check on your CPDs and also check on your certificates and kindly fill the complaint form as shared in our chat box. Thank you and have a good evening.